Group insurance for small business. Oregon's small employers account for more than 50% of the private sector jobs in Oregon. Beginning in 2015, businesses with the equivalent of 50 or more full-time employees must provide affordable health insurance or pay a tax penalty. Whether you offer health insurance to your employees or not, it is absolutely critical that you make your employees aware of their obligation to seek health coverage under the Affordable Care Act. And you also have to inform your employees they have access to guaranteed coverage in the individual market and that they may be eligible for government subsidies if the group coverage you provide is not deemed to be affordable under the law. How much does health insurance cost for a small business? Your small business has to cover at least 50% of the cost of health insurance for your employees. A nationwide average healthcare premium suggests that the cost per employee is about $6,163 a year. As the employer, this means you'll have to cover approximately $3,100 a year per employee. You also have an option to pay for employees' dependents' premiums. Group health insurance cost depends on location of business, ages of employees under the group plan, and your preferred out-of-pocket costs. If you want to spend less in monthly premiums, you can select a plan with high deductibles and out-of-pocket costs. Keep in mind, buying a health plan directly from the insurance company or through a licensed agent does not affect your health premium costs since all prices are fixed. However, a licensed agency like Health Plans in Oregon represents multiple insurance companies. Therefore, you can compare multiple health insurance plans that best fit your business's needs and budget. You may qualify for SHOP. SHOP stands for Small Business Health Options Program. Any small business in Oregon with 1 to 50 employees can purchase a certified plan from one of the participating insurers. Your business qualifies if you have an office or employee worksite within the SHOP's service area, have 50 or fewer full-time employees. Owner can count as an employee, but needs to have at least one other full-time employee to be eligible. Offer coverage to all of your FTE employees. Works about 30-plus hours a week for more than 120 days in a year. Enroll at least 70% of your FTE employees in your SHOP plan. However, employees with health coverage through Medicare, Medicaid, military, or another employer plan are not included in this percentage. Now, let's find out if your business is eligible for tax credits. Your business can qualify for tax credits if you meet the following criteria. Employ fewer than 25 full-time equivalent FTE employees, not including family members of owners, partners, or seasonal workers who work fewer than 30 hours a week and more than 120 days during the taxable year. Pay average annual salaries of $50,000 or less per employee. Pay at least 50% of FTE employees' premium healthcare costs, and purchase a certified medical or dental plan from a participating insurance company in Oregon. When to enroll in group health insurance. You can enroll any time of the year. No need to wait for open enrollment periods. At any time of the year, you can add employees or dependents on the group plan. At the end of the year, you can renew or change coverage. Do Oregon employers have to provide health insurance? For small businesses with less than 50 full-time employees, there's no penalty for not having health insurance. But of course, if you want a productive work environment, consider getting health coverage for your employees. What if you have more than 50 employees? If you have more than 50 full-time employees, you may face fines if you don't provide group health coverage. The price of the lowest cost health insurance plan should not be more than 9.69% of an employee's annual income. What if an employee declines the insurance offer? If an employee decides to not sign up for a health insurance plan, he or she can sign up for a plan through Health Insurance Marketplace during open enrollment period, November 1st to December 15th, but financial help is no longer available. The advantage of providing health insurance to your employees. What employers may reap. Investing in health benefits for your team gives your small business a competitive advantage. Policy premiums are deducted from salary schedules in contrast to individual health plans in which policy premiums are paid outside of payroll. Eligibility. If you are purchasing an individual health plan, there may be times when an individual can be denied insurance due to some eligibility restrictions, such as immigration or residency. Obtaining health insurance through an employer helps retain and reward staff and may help reduce tax obligations as well. As an employer, your contributions become tax deductible. Payroll taxes are reduced by 7.65%, and your workers' compensation premiums are also lowered. In summary, here are the key features of group health insurance plans. Cashless medical services at in-network hospitals. Employees covered in group health insurance do not have to go through exhausting tasks of filling out forms when hospitalization occurs. The cashless transactions within in-network facilities are said to be among the most valued features of group policies. Also, most group health insurance plans do not have a waiting period, meaning an employee qualifies for coverage the first day on the job, even for a chronic illness. Pre- and post-hospitalization expenses. A group health insurance policy also provides coverage for a pre- and post-hospitalization lab tests, x-rays, medicine, and consultation expenses for a specific period as mentioned in the policy document. The difference between group health insurance and individual health insurance. Premium costs. Buying in bulk often saves money. Therefore, group health insurance plans are traditionally more affordable than individual health insurance plans. They allow employers to offer quality coverage at a discount, and coverage is automatic. Consistency. Under a group health insurance plan, employees are only covered as long as they are employed, and the employer is paying the premium. On the other hand, with individual health insurance, coverage is consistent at all times, as long as the premiums are up to date.